When I first met Stacey, she was living in a hostel. She was pregnant at the time and had no antenatal care at all. So me and my colleague, we brought her to the hospital to make sure that she was registered with a midwife. There she had a scan and started her maternity care. The hostel wasn't really suitable for Stacey as she was pregnant and she was living with a lot of people who were either on alcohol misuse or drug misuse. Eventually, as time went by, she actually got a temporary accommodation with her partner. Here she started her first tenancy. We supported her then with going to all her appointments, which at the time was due to financial difficulties. She was unable to keep most of them if we wasn't there to do this, because she was still sorting the benefits out. Also managing money was another issue. At first Stacey appeared to be quite a volatile person. There was disputes in the hostel. Police were called out on a few occasions. But as time's gone by and we've established a relationship, she's actually now got respect for our service, and as we show respect to her, so she's gained a little bit of trust. Because social services are involved, there was a lot of issues around how that service was actually delivered to her. We supported her through all the meetings, explaining the outcomes and also the actions that were put in place. We helped her with those. Stacey now has gone onto a methadone program. She's doing very well. Her pregnancy went well. She didn't miss any appointments. Her attitude has changed dramatically in regards to how she comes across with other professionals. There's still a lack of trust there, but that's going to be something that's going to have to be worked on, I think, for a long time yet. Baby's now being born, and they've moved into a permanent address, managing very well as this is her first proper tenancy. And as I say, we've worked with her for quite a few months. Social services are still involved and probably will be for a long time after. But the outcome for Stacey is now that she will go to the Barbary Clinic to have a psychological assessment due to her mental health concerns, and hopefully she'll be assessed, and this will, well, really see whether she's able to maintain and care for her baby. As I say, it's a long road, and hopefully the future is going to be bright, and our support and other agencies still stay involved and are open to discuss things further.